For this video, we'll discuss the structures that are associated with the brain in regards to a CT scan. So we'll go from top to bottom, and I really think you'll get a better sense of what the anatomy is actually looking like from this video rather than from the textbook, just because, with the textbook we're seeing a few slices and a few orientations, and we're not really seeing the big picture and how it comes together. So I think by the end of this video, you'll have a better sense of kind of how everything kind of fits together seamlessly as we go through a given scan. So looking at the image, you can see we're at the superior aspect of the skull, really near the parietal vertex, or the vertex of the skull. So through the parietal bones is what you're visualizing there at the top. I think the graphic here will really help as it goes through. We can definitely tell that we're in a oblique orientation. Again, to save dose to the lens, that's the appropriate orientation to kind of go through the head. And as you kind of see that we're going through the slices, we can start to see some of that brain tissue coming out. The first structures always to kind of look at and to note are the cerebral hemispheres. So we can very clearly see this is the right cerebral hemisphere versus the left cerebral hemisphere. And then subsequently we can see the longitudinal fissure right down the center. The falx cerebri will go down that longitudinal fissure, so those are the meninges that just cover the brain. They fit in there, form an additional protection as well. So those are the major structures initially, in addition to the general structures of the sulcus and the gyrus. So the sulci are any of the grooves that you're seeing, any of those depressions, and the gyrus are any of the hills that we're seeing. So you can kind of see the difference here. So gyrus, etc., versus some of these sulci or depressions. Some of them are named, sulci. Some of them are going to be named fissures as we kind of go through. But just in general, I want you to get the general sense of sulci versus gyrus. So continuing to go down, what I'm going to start off with is just by documenting the structures associated with the ventricles. So you can start to see the lateral ventricles kind of coming out here. This scan was pretty set up pretty well in that the head and the appearance of the anatomy is fairly symmetric. Of course, it does depend on the CT technologist's ability to be able to position that patient in a nice symmetric orientation. When they do that, you can see that symmetry should be present within the structures as well. So looking at the lateral ventricles, we'll start off with the horns. So you can see that here's the frontal horn on both sides respectively, whereas here is the posterior horn respectively there and there. Additionally, you can see the structure of the choroid plexus here. You can see a little bit of calcification that's associated with that structure. So that visualization, though, is pretty clear. As we continue to kind of go through, you can see the splitting of those structures. So in regards, you can still see, yes, there's still lateral ventricles. It could be called anterior frontal here and here, or posterior, or occipital horns back here. Again, you can see a little bit of the choroid plexus there as well. So the next structure that we really should be able to, see is then going to be the third ventricle. And we can see that structure of the third ventricle here. Again, as we discussed in the lecture, just remember some of the structures that are near these areas as well as we go through this. So the area of the thalamus, for example, on both sides of the third ventricle, or the pineal gland, which is also demonstrated with a little bit of calcification here as well. So kind of continuing to go through, you can see the area of that third ventricle. And then subsequently now we can see a little bit of that transition to the fourth ventricle here as well. So definitely can see the fourth ventricle. So you can utilize the structures we know, like the pons, that we're able to demonstrate because we see the sella turcica, or the dorsum sella rather, is demonstrated quite well there. So dorsum sella, you can see the pons, you can see the fourth ventricle, and then you can subsequently see the cerebellum here as well. So continuing to kind of go through, of course, as we go down, you see less and less of those spaces. Nonetheless, you can see that cistern right here as well. So you can start to see some of those structures associated with the ventricular system. They're always going to be a little bit darker just because they're filled with cerebral spinal fluid in that regard. The only other structures that I really want to point out in regards to the ventricle system. I guess that's really all the structures I want in regards to the ventricular system there. So other structures, just to kind of reinforce and to reiterate, caudate nucleus is on both sides here of the anterior horns, anterior lateral horns. So again, here's the right frontal horn or right anterior horn, specifically the lateral horn. But with that, that's going to help us determine where the caudate nucleus is, and pretty clearly demonstrated in regards there. Kind of continuing to go inferior, some of the structures that I want you to definitely know the thalamus. Thalamus is visualized there. Definitely know the pineal gland. And then continuing to go a little bit more inferior, you can start to say, hey, what are some of these lobes that we're identifying here? So frontal lobe, of course, is important. You can see the optic radiants are demonstrated here, associated with the optic occipital lobe, rather. You can see the area of the insula demonstrated here as well. So the insula lobe. And then in regards to the kind of the floor of the cranium, so where you can see some of those bony-based structures in the midline, you can see the area of the sphenoid sinus. On both sides of that really is going to rest the temporal lobe. So we can think, all right, here's the temporal bones. We can see the petrous portion associated with the temporal bones, or the mastoid air cells there as well. So that's going to be a key. So definitely know that area as well. So those are, in essence, in a nutshell, those are the major structures that you're truly going to need to know. Of course, the cerebellum is another structure that you definitely need to know over here in the inferior aspect. You can see the area as we kind of pan down. We can start to see the area of the midbrain here, and then the midbrain subsequently is going to transition into the pons. Pons is subsequently going to transition. You can't see the medulla very well here, but we can start to see it here pretty well. So we can see the medulla oblongata there, and then subsequently then going down into that solid spinal cord as we go through or transverse through the foramen magnum. So lots of structures, of course, associated with the brain. There's a lot more than what I'm kind of pointing out here. The final one that I definitely want you to know, it'd just be really the area of the corpus callosum. So you can kind of see that connection being demonstrated right in through here. We can start to see those connections. So you can't quite see, I guess, that longitudinal fissure all the way through, which is telling us that that's the area of the corpus callosum there. So, in essence, in a nutshell, those are the the brain-based structures, rather. If we wanted to look at the same information in another window, we could. We have the opportunity to be able to do that and look at the bony structures. And oftentimes, when you look at a CT, of the brain, we're really looking at a CT of the head, because we do have the ability to be able to look at it in multiple different orientations. So while we can't see the brain very well here, we definitely can see the bones associated with the cranium and the face respectively. So hopefully this supplement definitely helps as we kind of go through some things in regards to traditional axial orientation that's going to be associated with the brain itself in regards to a CT scan. What's great about this patient is that this patient has also had an MRI scan. So that's what I have up right here. So you can start to see as we go through from the superior aspect to the inferior aspect, you can definitely see these structures in a whole new way. So what we're seeing here is an axial orientation. It's a T2 scan. You can tell it's a T2 scan, really, just like I said in the lecture. Just start to look at those ventricles, and you can tell those ventricles are really bright. And you can subsequently see them extremely, extremely well on this particular patient. So looking at those, you can see definitely the lateral ventricles. You can clearly see the horns that are associated with the lateral ventricles. So again, frontal horn, occipital horn. As we kind of continue to go through, you can see the area of the third ventricle respectively, and then as we continue to kind of go through, you can see those transitions right down into the area of the fourth ventricle there then. So you can see those transitions much better just because of the brightness that's associated with these structures. So again, that's fourth ventricle. And then subsequently, what I think is really kind of cool as we continue to go through, you can see how the spinal cord, that solid spinal cord, is then surrounded by cerebral spinal fluid as well. So pretty cool stuff in that regard. But really, the anatomy is very consistent with what we saw before, where we're able to visualize the sulci and the gyrus. We're able to visualize those ventricles and those connections. We can see the area of the caudate nucleus. We can subsequently see the area of the thalamus being demonstrated here, the area of the pineal gland visualized. We can see the midbrain. As we continue to transverse down, we can see, kind of see the area of the medulla throughout here, and then we can see, or rather that was the pons, and then we can see the medulla through here, and then transversing down into that solid spinal cord subsequently. So a lot of great detailed information. Look how bright the cerebellum is in regards to how we've can clearly observe the differences in the tissue structure between the cerebellum and this the cerebrum based on the appearance of those sulci and the gyruses that are associated with that tissue there. So just generally a different appearance, different orientations. And subsequently, speaking of orientations, we have the ability on this to be able to look at it in sagittal orientation as well. So just to kind of go through the body in regards to sagittal orientation, you can kind of see just in general how that looks from one side of the patient through the other side of the patient. And subsequently, once we hit mid-sagittal, that really reinforces some of those concepts that we talked about before. So the corpus callosum is nicely demonstrated. You can see the cerebral peduncles here. So the area of the midbrain, the area of the pons, the area of the medulla, and then that solid spinal cord here as well. So cerebrum versus cerebellum, nice and well demonstrated here. In between, just specifically, just look at the divisions. You can clearly identify those. So I think the different differences in appearances is definitely really pretty cool to be able to visualize these structures. Subsequently, of course, you can see some structures that we talked about, like the optic nerve being demonstrated. You can see the globe of the eye here as well. So great visualization. I think MRI is just on a different level in regards to what we're talking about this week with the brain. So just really great information in general. Just to be able to see the difference between a T1 and a T2. So here's a T1 scan. And remember how with a T2, the ventricles are bright. With the T1 scan, the ventricles are very dark. Subsequently, you can see that. You can very nicely visualize those structures accordingly. You can see the temporal horn pretty well of the lateral ventricle here versus the third ventricle here. And then subsequently, carrying on to the fourth ventricle. So, like I said before, great visualization in MRI, just so much potential. And, whether we're looking at it in CT versus MRI, just so much depth of information. So these concepts should not be, theoretical any longer when you're learning this anatomy, out of, diagrams, or you're learning it out of an X-ray projection. And some of those things, seem so very abstract because you're not able to visualize them well. That is definitely not the case when you're looking at CT and MRI because, regardless of the orientation, you can visualize so much really great information here.